All right. Good morning, everybody. I am Doug Roberts. I am the founder CEO of the Institute for Education Innovation. Thank you for being here for this workshop and presentation on PPE supply chain. This is something that last summer when we were preparing for another school year with our IEI superintendent members, I don't think most of us knew what PPE was or what it stood for. But here we are. And we're really excited to be having this discussion. We are broadcasting this live on YouTube. If you're having any tech issues with Remo, sometimes it's a little funky working through district IT situations. I recommend using Chrome, refreshing your browser. Worst case scenario, you can either find it on your phone or there's a link in the upper right where you can visit this event. We're broadcasting it on YouTube where you can't interact as much in real time, but you can listen and then maybe come back and interact with us, or you can contact us anytime if you want to get in touch with folks. The good folks at SDI have offered to do sort of free consults with any districts who are interested in getting help with their PPE planning, and that's really great that you guys are willing to help out districts in this way. I am here merely to MC and introduce our colleague, a member of our advisory board, great superintendent from just outside New York City on Long Island, Mr. Hank Grishman from Jericho Union Free School District in New York, who will introduce our guests today.
Great, thanks, Doug, and good morning, everyone, and thank you for being here during this the most incredible, challenging times that I think any of us have ever faced while we're all planning on or in the midst of trying to reopen our schools. I'm Hank Grishman. I'm superintendent of the Jericho School District, located in the suburbs just outside of New York City, and happily an advisory board member of IEI. I know that all of us, all of the superintendents have had an incredible summer, an unusual summer like we've never had before, in terms of spending literally every waking moment, 7 days a week, trying to figure out how we're going to open schools and open schools safely. I'm one of the things that I am so blessed with is that I have 3 grandchildren who attend the Jericho School District. And again, I love it's being able to see them throughout their elementary school, middle school, and high schools. I hope that I treat my grandchildren, their friends, and all 3,200 kids in Jericho as if they are my own kids. I have been a superintendent for over 40 years, and I can say, and I'm sure we all can say, we've never seen or faced challenges like the ones we're currently facing. We had a Zoom board meeting last night. We typically average 30 or 40 people attending our board meetings by either live or Zoom. We had over 700 people at our board meeting last night discussing the reopening of school, and frankly, one of the main focuses was on PPE, health and safety. How are you going to keep our kids safe? And again, while we've looked at our reopening plans and what education is going to look like, we have to figure out a way to manage PPE. Managing a supply chain of PPE is a whole new and different world for us, and one that we have very little experience. We've put together complex plans for reopening schools. We are going with reduced density. How are we doing that? AM, PM plans, alternating day plans. But again, the parallel of how are we handling our PPE needs while we're looking at managing our educational needs. I am very eager to learn today more from the professionals about how we might ensure that we don't see our supply chain for PPEs being interrupted. Our guest presenters have been supporting a steady supply chain of PPE for the DOE in New York City, and they have a different financial model that allows a district to simply pay a licensing fee and the materials are dropped to each site as needed. They've offered to all of our IEI colleagues and other interested districts a free consult to review our plans and provide recommendations on how our PEE needs will be met. We look forward to the presentation this morning, and with that, I'd like to welcome Jim Owens, Senior Vice President, and Lori Kaufman from New York City Project Manager from SDI to this morning's workshop. I know I am really eager to hear how they can support our kids and our faculty in Jericho schools, and I'm sure that all of you are eagerly looking to hear how they can support our needs in this crazy times that we're all living through. With that, Jim, welcome, and thank you for being with us this morning, and Lori as well.
Great, thank you, Hank, and thank you, Doug. And I want to thank our partners, IEI, as well as K-12 Prepare, and most importantly, the audience. I know making time during this challenging time in really what is unprecedented, it is not easy. So again, as Hank said, my name is Jim Owens. I'm the Senior Vice President of SDI. SDI is a services and supply chain company based in suburban Philadelphia with operations throughout the country. And Lori, if you would introduce yourself, please.
My name is Lori Kaufman. I'm the Vice President of MRO Solutions, and I am on ground zero at New York City Department of Education from the beginning.
And I'm going to share my screen here. Can you just tell me, Lori, if you see that okay?
I can.
Great. All right, so the title of our presentation is In the Eye of the Storm, Lessons Learned from COVID-19 School Closures and the PPE Supply Chain. So one thing I'll promise up front is this is not a sales pitch. We're not going to tell you that there is a specific way to correct the problem, and last but not least, it will certainly will not be death by PowerPoints. We got a handful of slides to get through, and we'll really make this interactive as best we can.
Jim, if I could just jump in real quick, just for the audience.
Yes.
So the way Remo does this, you've got a few different tiles on your screen. If you want to zoom in on the slides, there's a little four-way arrow thing in the top right corner of the window that has the slides, so you can maximize that to see that. I just want to make sure people can see what you have up there. There's a chat over on the right side of Remo where you can put in questions or thoughts for the folks, and I will try to bring those to the stage as you have them. And after the presentation, the SDI team will be around to answer individual questions. So we'll be sticking around for the full hour. Okay? Sorry, Jim. Thanks.
That's fine, Doug. Thank you. So, we mentioned that the phrase lessons learned, and the fact is that we're 5 months into this pandemic, and the reality is we're learning new lessons every day. And sometimes it's hour to hour. And because of the unprecedented nature of the pandemic, there is no playbook that we can go to and pull off the shelf and say, okay, here's what we do next. So we're learning on the fly, and we're failing in some cases, and we're succeeding in others. And hopefully what we'll do is be able to share some of our lessons that we've learned over time, and also some of the emerging trends that we're seeing across the industry that we can share with you and sort of easier paths, so to speak. The situation is highly dynamic. In certain cases, it's volatile. I was reading even a story this morning in the Wall Street Journal how Florida is just a few days away from reopening their schools, and the parents really have no clue what's going to happen because the districts are in such a heated battle with the governor and the state. They've seemed to have come to an impasse. So, I really thought, if you asked me 3 months ago where we'd be today, I thought we would all be heading back to school and things would be, somewhat in a routine fashion, but it feels as though we're a little bit away from that as well. So in terms of the presentation, what our intent is to share our experience in New York City as their supply chain partner for PPE and other essential materials. And again, perhaps there's some emerging trends and lessons learned that we can share with you that you'll get out of this presentation that will ease your path as you restart schools and start operations. And as Doug said and Hank said, we're happy to consult with you if you have questions during the presentation or after, or even next week. Reach out to us, and we're more than happy to share what we've learned along the way. I'm going to advance the slide. All right, here we are. So real quick, who is SDI? SDI is a digital supply chain services and solutions company. And And so one of the ways I typically describe who we are is I first describe who we're not. And what we're not is we are not an industrial or PPE distributor. We're not a traditional supplier in that sense, but we do buy from thousands, and in some cases, tens of thousands of suppliers across the country and across the world to help facilitate the supply chain of our customers. The other thing is we're not a Johnny come lately. If you've been in this for the last few months, you realize your phone is ringing off the hook and you have lots of emails and texts from people you've never heard of before trying to sell you PPE or present themselves as an expert in the space. That's not us. So we've been in business for about 50 years, and this is all we do. And in fact, we've managed the supply chain for the New York City Department of Education for just about 20 years now. So we sort of know what we're doing. We've been through a lot of things before, and we're happy to be here this morning sharing our experience. One of the things that we do as part of our mission is helping to change the way people think about MRO, maintenance, repair, and operations supply, but also about their PPE supply chain. And again, that's what our hope is this morning, is that maybe you'll come away with some different ideas or a different perspective as to how you should be thinking about the supply chain, what questions you should be asking yourself and your staff, and maybe some different ways of approaching things within your own organization. So I'm going to turn it over to Lori in a second, but I wanted to kind of give you a sort of a high-level overview of the New York City Department of Education. It is the largest public school system in the U.S. There's roughly 1,800 schools spanning those 5 boroughs. There's roughly 1.1 million students, and it's one of the oldest school systems in the country. And it's a highly complex infrastructure. So you have buildings that are 100 years old. You have buildings that are less than a year old. You have a lot of different cultures. You have a lot of different languages that are spoken. One of the things that surprises a lot of people who talk about New York City is beyond what they do from an education perspective. There's a lot of other services that the DOE provides to its constituents. And one of the things that surprises people more often than not is there's over 100,000 children in the New York City Department of Education that are homeless. And so they depend on the DOE for their nutrition as well. And so that in and of itself is a huge and complex part of some of the services that the DOE delivers, and we help facilitate, in alignment with them. New York, though, the good news is they're fairly tough people, and they've been through a lot before. So they've gone through the financial crisis and SARS and Y2K, 9/11, right? They've learned to be agile and resilient, but the fact is this time was really different. We're not only talking about a global, healthcare crisis, but it's a global supply chain crisis too. And it happened both on the demand side and the supply side. So on the supply side, what most people didn't realize before it happened, and I think Doug said it best, is, a year ago, none of us could even spell PPE. Now all of a sudden it's front of mind, and it's what our constituents want to talk about more than anything. But the vast majority of supply for PPE, whether it's an N95 mask or a surgical mask, resided in the epicenter of the epidemic, Wuhan, China. And so, that in and of itself was a huge shock to the system. The other part of it was, on the demand side, previous to the pandemic, most people that use PPE were in the healthcare space or in very specialized areas with research and that sort of thing. All of a sudden, in March, everybody and their brother needed a mask. And so the demand was far outstripping the supply of materials that were available. And unfortunately, that introduced, an opportunity for a lot of bad actors. So you had a lot of opportunists that were showing up, and they're still out there today, and they're knocking on your door and sending you emails and making calls, trying to sell you PPE. What we're finding, and we've been burnt by some of this as well, some of these opportunists are, first of all, they're not delivering. They're not delivering on time. They're selling to people at the highest price. So there's a lot of price gouging going on. And in fact, there's just a lot of counterfeit. So there's a lot of N95 masks that are out there that really aren't N95. And so you need to be very careful about who you're dealing with and making sure that they're vetted properly and that they're really certified and reliable people. You may recall in the news a couple of weeks ago, there was a major finding from the FDA and the CDC about hand sanitizer. So there were a number of manufacturers based in Asia that were delisted from the N list from the CDC because they were found to have methanol as opposed to alcohol in their hand sanitizer. Very, very dangerous. So sometimes the cure that was being sold was worse than the disease. Again, these are things that we're learning every day, and I'd like to, I wish I could tell you that most of that's behind us, but it seems like, we've got more, further to go. So real quick, in terms of emerging trends, what are we seeing? So I think there's a realization that the pandemic resurgence is not a one and done. This is something that, I don't believe once school starts and the curve flattens and we go back to living our lives, that people are treating this as being over. I think most organizations are now finally at the point where they're saying, we need a permanent solution. What that permanent solution looks like exactly, I don't think anyone really knows, but I think people are realizing that, supply chain and PPE are here to stay. And they'll now become part of, the risk management plans for schools and for other organizations. But, in order for that to happen, you need greater collaboration and communication across all those functional departments. So we're seeing more of that as well. It's a little bit like, what we witnessed after 9/11, people coming together and in pursuit of a common vision. And I think the same is happening now because, as Hank said, typically in a board meeting, they'd get 30, 35 people. And last night they had 750. I think that's a really good indicator of, how serious people have become about this. And they're very concerned. And I think, again, that's, something to think about. So there is this shift in perspective from, tactical procurement to, a safety and health driven supply chain. So what I mean by that is what hospitals have done and what other healthcare institutions have been doing for years is something that will be adopted by manufacturing organizations and K-12 and higher education and a number of other industry verticals because they're going to have to. Other things that are starting to happen as part of the trend is this shift towards technology and e-commerce. So one of the things we've witnessed over the past couple of years in the K-12 space is the growth of Amazon Business and other dynamic marketplaces for non-essential and essential supplies alike. I think that trend is going to not only continue, but it's going to accelerate. Because I think what most K-12 districts found was that they needed to be much more agile. They needed to be able to act much more quickly and find supplies outside of their traditional supply chain. So I look at that being not a certainly not a silver bullet, but something that's going to go forward. The other thing that we're starting to see also is people realizing that you can't solve new problems with old solutions. And so what we've witnessed a lot early on, particularly in the pandemic, was school districts going out with RFPs, but the RFPs were written almost exactly the same way they were a year ago, 2 years ago. And the metrics for winning that bid were exactly the same. So there seemed to be a little bit of a knee-jerk reaction. I think what we're seeing now is this realization that you need new solutions, and in order to do that, even though the solutions aren't prescribed and mainstream just yet, going out with a request for solution makes a whole lot more sense, because then you get suppliers to come back to you with innovation and speed and creative problem solving that encompass a lot of different things. So it's not just about the lowest price, although price is important, particularly in this budgetary environment we're in, but making sure that these suppliers are reliable, that they're going to carry inventory for you, that they're going to provide inventory for you, that they're legitimate, and that the materials they're going to supply to your staff and your school children are actually safer than not using nothing at all. And I think that's a big issue. So at this point, I'm going to turn it over to Lori Kaufman, and Lori is our VP of MRO Solutions. I think one of the things that's important to know is, Lori's been at this for now over 20 years and has been, on the ground in New York City pretty much daily. And when the pandemic struck, she's lived this life, since March, and has had a telephone glued to her ear for probably 18, 20 hours a day, and even to today. So I'd ask Lori to join me today to kind of give you the boots on the ground, practical perspective of what happened, what we've learned, and then, where are we going from here? So Lori, with that, I'm going to turn it over to you.
Thanks very much, Jim. I'm going to actually take you back a little further than just December 20th, because a lot of things started to happen that has helped SDI jump in as quickly as we did. 20 years ago, SDI became the strategic partner, not a distributor, for the city of New York. And that's really key because we became part of their journey to provide all kinds of services for both custodial, sustainability, maintenance, and now food services. So we kind of became a partner and work with them on a daily basis to get what they need when they need it. And we manage their inventory. So we started to know in December something strange was going on. We didn't know what it was, but all of a sudden a lot of our supply chain was broken. Couldn't understand it. And we started calling manufacturers. We started calling distributors why product was being delayed. And at our levels, we've run a lot of algorithms to know what we need for the city of New York. We've been doing this long enough that we know what typical schools need on a regular basis. And our inventory was going down. And we started to call manufacturers that key projects that we knew were key for us opening up for doing certain projects during winter break. And we were told, well, the manufacturing plants in Wuhan are down because of the holidays. It was Chinese New Year's. Finally, in January, end of January, beginning of February, we realized there was something else going on. And we got out the boots on the ground and tried to get supply chain changed over quickly. And because we're not a distributor, we're agnostic to product. We really have a great group of suppliers and manufacturers who kind of jump at our demands because we've been involved with them for so long. So February was very difficult getting product in. We worked very closely to buy up whatever we could across different coasts, from the East Coast to the West Coast, wherever we can get product to fulfill the 1,800 schools in New York. So I was on the ground in the beginning of March. We started to see people getting sick in the building. We knew there was a serious problem. And on Friday the 13th, we really saw some real serious issues going on. And I was asked by the mayor's office to be part of a call on Saturday morning. So as soon as I got that call, I was actually at JFK Airport thinking I was going to go for a relaxing vacation, which never happened. And we were on a morning call with all the different agencies in the city of New York. Some of the agencies were in complete panic because they always went to a supplier. They may have had 1,000 different suppliers, giving them one item. And so they didn't have one neck to choke. The Department of Education has one neck to choke. Unfortunately, it's my neck and SDI's neck. So on March 14th, I had spent a lot of time the evening before calling up any manufacturer who I knew had PPE or any kind of products that I thought was going to be needed to keep the schools open. It was not yet the winter break. And what we found was we had a lot of cooperation because we've been doing this for so long. And so by the call on the 14th, we started processing millions and millions of dollars of orders for hand sanitizer, for masks, for disinfectant. And by Sunday, we had a few $1 million already in our warehouses ready to distribute to the schools. And I mean, the city of New York really jumped on this. They really understood by that weekend that they had a serious problem. At that point, they thought they were going to open up schools, which obviously didn't happen. But unlike a lot of other districts, like Jim said, they have to keep buildings open. It's very important. There's 800 buildings throughout this crisis that we've kept open, where we're feeding families, not only students. Anyone who comes up to these 800 buildings, they can get PPE. They can get 3 meals a day, bagged lunch bags, basically set up, feminine hygiene products, hand sanitizer, and we've kept those buildings afloat over these last 6 months. It's been pretty amazing, and everybody's jumped. Even though the other 1,000 buildings are closed, we're still supplying those buildings, getting them ready for school opening. So between March 14th and the present, it has been nonstop. It's not only about face masks, as this slide says. We've been ordering sneeze guards. Filters has been a big problem. And we put in an order for 185 new filters to get these schools open for September 10th. Before this COVID-19 hit, we were not allowed to supply hand sanitizer. Kids were drinking it 15 years ago, and we took it all out of our catalog. Now, all of a sudden, not only did they want hand sanitizer, they wanted a dispenser in every single classroom, which is in excess of $75,000 to get them started. there's no way one manufacturer can do that. So because again, we're agnostic, we brought in 5 different manufacturers to supply in excess of 75,000 dispensers, which are being installed as we speak, so that every student will be able to have a hand sanitizer, a dispenser in the classroom. And we've even calculated how many, if they went every day, 7 times a day, how quickly that would be consumed, so that we can get our next order to get us through the next 6 months, because we know this is not ending. We're working very closely with principals, facilities people to get every single item that we could possibly think of. New York City has put us in as a partner, so I'm involved in daily calls. First call every morning is to see where the products that we've ordered to date, where they are in the supply chain. Even the biggest manufacturers break down. I mean, I had a terrible call last night that 23,400 dispensers that I expected to be installed by the end of the month are there. We can get the dispensers, but I can't get the product. Dispensers without product is meaningless to me. So I had to spend last night trying to find another couple of those suppliers who were providing the balance to increase those orders. So it's ever changing. Every day we have a Gantt chart that keeps track of these key items that are required to open up the schools. And I send that report out on a daily basis. On a weekly basis, the mayor has it. He's concerned about not only the cleaning products, the PPE, but I ordered 4,000 electrostatic backpacks. I mean, with tablets that need to clean the schools every night. They've hired more custodial staff so that every day these buildings can be sanitized. So it's ever changing. Every union has a different requirement, what they think is necessary to keep these schools open, and for not only the student safety, but their safety. The teachers union has put, for good reason, and I have a daughter who's a teacher, so I'm really concerned that they have the right PPE so that they could stay safe and stay at the distance, but still give the proper learning. So it's it's been an amazing experience. And because again, we're agnostic and we've had to change in times, when I realized, I never believed that wipes would be the necessary product that we couldn't get. And we could not find a wipe in this entire country. We thought we had ordered a big supply, and the manufacturer said the government took it, can't get it. It's been allocated at the federal level. We called a local supplier who typically gives us cleaning supplies and floor finish. And I said to the CEO there, I said, Jonathan, I'm desperate. I need wipes. What can we do? We're not going to be worrying about floor wax. Can you somehow switch your plant and start making wipes? So as of today, he's delivered over 25,000 canisters. There's 800 wipes in the canister. My goal is to, by school opening, I have 2 other suppliers who are doing the same thing, to have a dispenser canister at each teacher's desk so that they have the proper requirements of opening up schools to be able to clean any surface that's available. So it's ever changing. And every day there's a new demand, a new request. And again, because we have so many different suppliers and relationships that we've built, I don't care who I buy it from, as long as the total cost of ownership and ETA works for the city of New York. That's my only goal. A lot of other agencies have jumped on the DOE's contract. And so we've been supplying other agencies who have unfortunately not been able to get their suppliers to provide the necessary information of product that they need.
Lori, just one thing I wanted to interject as well. It's, on the right column is, and one of the things that's not being talked about is, because everybody's so preoccupied with PPE and other essential materials, as they should be, is there's a lot of other commodity items that school districts are likely to face shortages with because of the country of origin. And so we're starting to see that in a lot of other maintenance items across our portfolio.
Sure.
But even in, from a consumer perspective, if any of you have been to a Walmart lately or to a Target, and you go to the toy area or the sporting goods area and you look at the bike rack, you're going to quickly realize there's not one bike in those racks. And there's a reason. It's because almost 100% of the bikes that are manufactured in the world come from that area of China. And so there's been this shortage that's been going on for pretty much forever, since this really started. And that's just one of those indicators. There's a lot of other items and examples I could offer, but I think that's a good indication of things to come.
Absolutely. I mean, the supply chain is absolutely broken. I mean, just getting the canisters to put, I can get wipes, I can get the chemicals to make the wipes. The problem is we couldn't find canisters for a while. Same thing with hand sanitizer. At one point at the beginning of this, I had all the product, but they couldn't fulfill the bottles because the bottles were coming from Asia. So it's really been a challenging time for all of us. The good news is, for at least New York City, because we leveraged their spend so well, we have not paid exorbitant prices on anything. Our supply chain has kept their commitment. I think they know they're looking long-term. I have not gotten price increases. I've had delays. That's probably the biggest issue of all, but we're on top of it. And we've had some incredible cooperation from all of the supply chain in the country.
Great. Hey, Doug, I seem to be having a little bit of a problem with advancing the slide here.
Yeah, did you just take the screen share off, it looks like?
Well, I'm gonna go back in.
Okay. That was a good time to stop and just see if there are any questions out from the group. If you want to ask in the group setting here, or you put them in the chat or the Q&A. Otherwise, we'll be finishing up soon. We'll come out and talk to folks at the tables. You all set, Jim?
Yep, I'm all set now.
All right.
Good. All right, so thank you, Lori. That was very helpful. So, what are we learning? And as I said in the beginning, we continue to learn that the supply chain and that the supply base continues to evolve, and it seems like everything else around us continues to evolve. The big things I think that we're learning, and it's not just in K-12, but it's across pretty much all industry verticals, is prior to the pandemic, there was a conventional wisdom that existed that said, you really want to drive reliability. You want to put all your eggs in one basket. And so, people organizations would sign a single source contract with Grainger or with Office Depot or Staples or whomever it may be for their Jansan products, their office supplies, some of their MRO materials. And so what's happened, because of the pandemic and because of the shortages, and then when the federal government stepped in and put a lot of those larger OEMs and distributors on what's called allocation, so their supply was prioritized, and dictated by the federal government. A lot of K-12 school districts, as well as a lot of businesses, were left sort of high and dry, and they were left to their own devices to go and find, alternative sources of supply, particularly at a time when supply was really constrained. So, the first learning really is diversify your supply base. What you really need is probably 3 levels of supply. You need a primary, you need a secondary, and you need a tertiary supplier for each of those essential materials, whether it's a mask or sanitary wipes or disinfectants or whatever it may be. You also want to understand, beyond that, is where are these products coming from? If the country of origin for each of those products happens to be Asia, there's probably a little bit more risk and probably a little bit more of a lag time between order and receipt. So you want to, not to say you shouldn't purchase from global suppliers, but you probably want to balance, some of those global suppliers with maybe a few domestic suppliers as well. And then the last thing, but certainly not least, is have a mechanism for quality assurance to make sure that whatever you're receiving, whatever you're ordering, that when it does receive, end up on your dock, that it's actually the product you thought you were buying, and it's a safe product for your teachers, your custodians, and your students to use. The other thing is agility, right? Is centralizing those controls. So whatever you can do to consolidate the control and some of the decision making as it relates to these suppliers and the supply chain. I think it's going to serve you much better. It's going to give you much more control and the ability to make decisions more quickly about all the different things we talked about. And then the third thing is making sure you have a focus towards innovation. So again, think differently. View PPE through the prism of a supply chain perspective, and the fact that it's mission critical and essential, but also have an eye towards what are things that you can do, on the fly, but also longer term, to make sure that your supply chain has continuity and there's some certainty in it. So Lori mentioned the use case where we had a Jansan supplier that was making floor wax that we were able to persuade and partner with to produce disinfecting wipes. You know, a great success story for them, for us, and for the DOE at a time when we needed it most. And sometimes that's just, you know, it's the ability just to ask that question, or just to think a little bit differently and say, hey, maybe there's a better way of doing this, as opposed to saying, hey, my supplier said I'm out, and that's just all there is to it.
One of the things I just want to, sorry to interrupt, Jim, that's been really important, because some of these products are new products to the city of New York. We were able to, because we have boots on the ground, to make sure that the quality of the product was what they needed. And so before we distributed anything to the schools, it was checked by our own team. And that really helped, because like Jim said, there were some bad eggs out there. And I've been working for a lot of years, and the first time I ever cried in my career was because of PPE, because there were guys that you were placing orders, and then they would put it out for a higher price, even though you already put the PO in. So there's been bad stuff going on. One day I'll write a book about the nightmare of COVID-19, but it's been in a lot of ways, if schools open September 10th, which everybody at the City of New York says they will, I know that we provided whatever they needed to get that accomplishment.
Thank you, Lori. So one of the things we offer is something, again, it's not a hard sales pitch, but PPE as a service. And it's really designed to address the risks that are inherent in a single source supply situation. So as I said at the beginning, you know, SDI is a supply chain solution and services firm. So we're brand agnostic when it comes to any product, whether it's an MRO product or a PPE product or other essential supplies. So, you know, we have a very large and actively managed base of both domestic and global suppliers. And that's, you know, dealing direct with OEMs, distributors, and more recently, marketplaces like Amazon Business, Alibaba, and eBay, because sometimes that's what you need to do in order to make sure that you have continuity of supply, especially in the environment we're operating in right now. And the thing that's unique about PPE as a service is it allows large, you know, organizations like New York, but also medium and small size school districts to tap into our expertise and our experience and the infrastructure that we've built, quite frankly, over 50 years. So, you know, it's instead of having to build all that fixed cost yourself and take all that time to build it out, you can tap into what we already have available to you. So it's a variable cost model. School districts can, you know, gain immediate access to reserve stock inventory, 24/7, 365, you know, centralized sourcing and procurement support. So at times when, you know, maybe it's 6 months from now, maybe it's 6 years from now, there's a flare up, or there's another epidemic, or, you know, God forbid, there's a pandemic, that you have a partner that you can tap into very quickly and make sure that you have continuity of supply and that you're going to be taken care of. And then that partner also is focused on innovation, you know, seeking new and better ways and cross-pollinating things that we learn in the petrochemical industry into K-12 or K-12 into higher education. An example of that is on the right column. So Ascend Performance Materials is one of our customers, and they're a customer that they're an organization that produces nylon 6/6. So they're a very large petrochemical manufacturing company. And when the pandemic struck, they realized they had technology on the shelf, so to speak, they were going to use for automotive and hospitality industries in the form of, you know, finished hard good products. But they also realized this technology could lend itself to safe masks or safety masks. So they actually very quickly created a new product line that they're calling Active. It's a technology that is created into a reusable face mask, and the way they're positioning it and marketing it, which I think is very smart, is it's not for the masses, it's not for everybody, but it's designed for, you know, what they're terming essential employees. So in the case of a K-12 school district, the essential employees would be the ones that are in the high traffic areas, in the high touch areas that are interacting with a lot of people. So, you know, think about teachers and janitors and custodians. They may need an extra layer of protection, and this is the kind of technology that allows that, because it has an antimicrobial built right into the polymer itself. So these people not only need protection for themselves, but they can also become super spreaders. So anybody that's using a conventional mask that happens to come in contact with somebody that has COVID or the standard flu, it gets on their mask, invariably people touch their masks, whether, as much as we're told not to, you touch your mask, you touch something else, or you touch another person. This eliminates or mitigates a whole lot of that from happening. So I offer this only as a suggestion that, hey, there's other things that are being developed. Oftentimes it's coming from places that were never expected, and it's innovation is the mother of necessity, right? So I'll stop there. Where do we start with PPE as a service? So the first thing we would do is a confidential supply chain risk assessment, and that can be done through data analytics as well as on site. So we're happy to do a phone consultation, and there's no fee for anything like that, and it kind of help you along with some of the preparedness planning you're doing. But if you want to do a little bit of a deeper dive where people come on site, our professionals come on and they do a real evaluation of the facilities themselves and look at inventory and how you're purchasing and the direct to receipt process, that's where the risk assessment comes in. And that's that's typically probably less than a day, and some of the larger districts can be more than a day. The most important thing is, from a K-12 leadership perspective, is what am I going to get from this? And the reality is what you're going to get is some recommendations, and the recommendations are fairly generic. But what we like to say are these are things that are actionable on day one. So we're going to give you recommendations that you can use today to mitigate your risk and improve operations. We're also going to give you some recommendations that you can do tomorrow, in the intermediate term. And then we'll give you some things that are longer term. And in addition to that, we'll say, and if you would like us to partner with you, here's what else we could do from an SDI perspective to help augment and accelerate, where you're trying to get to, so you get there a little bit faster.
Great. Thank you.
Go ahead, Doug.
Sorry. Thank you, Jim. Thank you, Lori. I think I want to give a little time, if it's all right with you guys, for you to kind of get to visit with folks out at the tables.
Absolutely.
Anything you wanted to say sort of in conclusion?
Yeah, so real quick, thank you all for making time again at this critical juncture. The next slide, and we'll make the deck available to everyone. We'll have our contact information, and if you're interested in an assessment or just reaching out and having a phone conversation, please do. And we'll make
IEI building. Yep. Excellent. Thank you, Jim.
I just want one thing. I see a question about smaller districts out there, and some of these small districts they've gotten in touch with me. My cell number apparently is everywhere in the tri-state area, and they've jumped on. A local school district near my home has called me and said, can we buy off of you, from you? And I said, sure, if I can help, I'll help. And so we've actually even leveraged New York City spend by helping some of these smaller school districts who've requested, I am desperate. No one's willing to sell me 1,000 masks. I'm buying millions of masks. They want 1,000, and they're not getting the attention. So we've actually helped some school districts and local universities who can't seem to get the product that they need. I know that's a concern for small districts, because when I call, I order 5 million. They're calling for such small quantities.
All right. Thank you both very much. Glad to have you here. And we'll all be out at the tables to chat with you. And please feel free you can find them in the SDI booths, or we'll come talk to you. Thank you both. Glad to have you.
Thanks, everyone.
Thank you, Doug.